Welcome to Module 4.1, where we'll introduce the foundations of qualitative research in healthcare. After exploring quantitative approaches last week, we now turn to methods that help us understand the human experiences, contexts, and meanings that shape health and healthcare. This module will provide an overview of qualitative research, its key characteristics, and when these approaches are most appropriate for healthcare inquiries. Qualitative research is a methodological approach that explores meanings, experiences, and perspectives rather than measuring numerical outcomes. While quantitative research focuses on numbers and statistical relationships, qualitative research emphasizes words, narratives, and descriptions. It seeks in-depth understanding of phenomena in their natural contexts, recognizing that human experiences cannot be fully understood when isolated from their social, cultural, and personal environments. Qualitative approaches typically emphasize depth over breadth, studying fewer participants but exploring their experiences more thoroughly. This naturalistic, real-world approach allows researchers to capture the complexity and richness of healthcare experiences that might be missed by more structured quantitative methods. Some key characteristics define qualitative research. It typically follows an inductive reasoning approach, building from specific observations toward broader patterns and theoretical understanding. Research designs are flexible and emergent, evolving in response to initial findings rather than being fully predetermined. The researcher serves as the primary instrument for data collection and analysis, requiring reflexivity about how the researcher's background influences interpretation. Data is rich and descriptive, capturing participants' own words and perspectives. Qualitative research aims for holistic, contextual understanding that acknowledges the complexity of human experience. These characteristics make qualitative approaches particularly valuable for understanding the nuanced, multifaceted nature of healthcare experiences for both patients and providers. Qualitative methods are particularly appropriate in several research contexts. They excel at exploring new or complex phenomena where existing theories may be inadequate or unavailable. They provide powerful tools for understanding lived experiences of health, illness, and care from patients' or providers' perspectives. Qualitative approaches are essential for investigating how cultural or social contexts shape health behaviors, beliefs, and outcomes. They're valuable for generating theory or hypotheses that can later be tested quantitatively. Increasingly, qualitative methods complement quantitative findings, explaining the why behind statistical relationships and informing intervention development. By recognizing when qualitative approaches are most appropriate, researchers can select methods that best address their specific research questions.